Hi, everyone. We'll just give a second or two for people to join. I can see the participant count going up, which is always reassuring. So welcome. Welcome to our first Canadian Pediatric Cancer Consortium Town Hall. It's a bit of an experiment in technology, so we're hoping this works for everyone, and wherever you're joining from, whatever time zone, welcome to this session. So my name is Christine Williams, and I am the Executive Director of the CPCC, and you'll be meeting more of our important staff and stakeholders shortly. But we wanted to start this meeting with a land acknowledgement. And to do that, I'm going to pass it over to Dr. Stacey Margerison.
Hi, folks. Nice to have so many people joining us today. I've done a lot of reflecting on and learning about land acknowledgements. And there's a lot of folks who suggest that just reading something that's wrote is probably not the right way to do it. So we have developed something as the CPCC so that we have made sure that we are inclusive of our whole national community. But for myself, I'm coming in to you today from my office at McMaster, which is on the traditional territories of the Haudenosaunee and Anishinaabe nations. I have spent a lot of time learning and working with our local neighbors and folks from these communities, and for that I am incredibly grateful. I have had the privilege of being around for lots of land acknowledgements that some of our local folks are doing, where there is a moment to pause and be thankful for the world around us and our environment, because without it, none of us would be here. And so I'd like to think about that as a starting point. But further, I'd really like to focus a little bit more on the fact that on Saturday is Orange Shirt Day. And so perhaps you can flip to the next slide, because I think land acknowledgement is not just about land, it's about place. And it's about, and place is about place in the world and time. So to reflect a little bit, for myself, how did I come to here? How did I come to wearing an orange shirt and being the person being asked to reflect? I have been at MAC now for 10 years, and I have been fortunate to be part of the care team for a number of our Indigenous children here at MAC, and a couple of whom the care that they received in coming to truth and reconciliation, first with truth. The care that they received here was not the kind of care that they needed, as much as everybody was certainly coming from a place of good. And I think that's the truth for a lot of kids from First Nations, Inuit, and Métis communities across the country, that they come to our centers and the care that they get, while well-intentioned, can also be harmful. And I think we all need to keep in mind that as we build this organization, we really need to consider the care that we provide and how do we work to include Indigenous partners in care on the ground, in our research studies, and in the way we build this organization. And that's a big piece of my own reflection. So when you guys think to yourselves, what can I do? How can I be part of this truth and reconciliation? First, you need to know what the calls to action are for health. And so I think some of the important ones that we need to recognize are the calls 18 through 24. 18 being that we need to acknowledge that the current state of Indigenous health across the country is a direct result of policies, residential schools, and current and ongoing racism that exists, and that's a big component. That the second call, number 19, is that there needs to be measurable goals and health outcomes, and we need to follow those, research, and publish on progress in that regard. So some of the work I did a long time ago is looking at gaps in outcomes for Indigenous kids, and we know that there's a gap in survival. As a basic first step, we don't know other things, and there is lots of work to be done along with Indigenous partners, and that is what we're trying to build here. that we need to respect and address distinct health needs of Métis people, Inuit people, and off-reserve people. That number 21 is that there needs to be sustainable funding for Indigenous healing centers, and we need to be able to work with Indigenous providers in that regard for our patients. Call 22 is that those who can affect change in the Canadian healthcare system need to recognize the value of Indigenous healing practices and work in collaboration. And we all need to keep this in mind. A lot of the work we do, we think we have the best idea. We know exactly what's best for families, and our Indigenous families are telling us what's best for me is individual, and you need to ask, and we as a group really need to be able to work with and combine those practices for best health for folks. At all levels of government, call number 23 is to increase the number of Indigenous health professionals working in healthcare fields, ensure retention, and provide cultural safety, cultural humility training for all health professionals. And this is some of the work we are engaged with as well. And similarly, 24 is to make sure that exists within medical and nursing schools. So everybody in their own regard, most of us are working out of academic centers. We need to push our local people. So I'd like you to reflect a little bit on how you're incorporating that work. And here at the CPCC, some of the work we're doing is working with what we are currently terming an Indigenous Council, where we're pulling in the assistance and the goodwill of a number of folks who think about Indigenous data governance on a daily basis, think about principles and important features that we need to ask for our Indigenous patients to really build an inclusive community moving forward. And so as I reflect on Orange Shirt Day and the National Day of Truth and Reconciliation, these are my promises to this community, is that these are our focuses for our work, and that I will continue to hopefully remind you that needs to be a focus for you as well.
Thank you, Stacey. And thank you for today, but also for your empathy and your thoughtfulness and your commitment to listening to Indigenous and other equity deserving communities. I think that's the kind of tone we want to set. And we're very fortunate to have you as one of our leaders and to be leading the Social Justice, Indigenization, and Inclusion Committee. So thank you. So I think we'll move on to the meeting itself and the agenda. So this is what we are going to talk about today. First of all, what is the consortium and how is it operating? We're going to provide some updates for you on the theme and group activities. So the themes and groups that make up the consortium and the work that we're doing and where they are at and their progress and priorities. We're going to remind you about an upcoming important meeting in December, which is consortium-wide, in which you are all invited to attend. And then we're going to dedicate the last part of this meeting to an open question and answer session, for which we will be using a tool called Slido. So maybe we can go to the next slide and describe that. So Slido, for those of you who have not used it before, very simple to use on your phone or your laptop. You can simply go to slido.com, and the code for this meeting is CPCC-CEPT. You can also just hover your phone over that QR code, and that will pull up the website. And when you go to that, you will see that little screenshot there that has a simple text box in which you can type a question. So you are welcome to do that at any point during the meeting to add a question. We'll moderate them just to make sure that they're appropriate and not repetitive. And then we will post those for everyone to see on Slido. So you will see other people's questions. And you can also vote for other people's questions. So you can upvote or downvote questions. So we would encourage you to use that tool. And then at the end of the meeting, we'll come to that Q&A and address those questions. If there's anything we can't answer or we run out of time for, we'll make sure to circulate answers to the questions later. We've also enabled the chat function. I see a few people have used it because I saw some thumbs up float by. You're welcome to use that as well to comment on anything or react to anything. Make sure you toggle on the everyone box, or you will just end up texting the CPCC staff. But we will ask you if you have questions to put them in Slido, because it will be hard for us to follow along on the chat. So I'm stalling a little bit so everybody can get their Slido up and operating, because we're going to test you with a couple of quizzes. So next slide. Okay, first simple quiz. Are you a fan of pumpkin spice? Please enter your response. And then we'll be able to show you live. There's a... Yeah, we'll give it a couple more seconds. Okay, so I would say that the no's have it. I do appreciate 12% who didn't know that pumpkin was a spice. I tend to agree. Okay, next question, and well done. Our next question is actually one we'd like to know the answer to, which is, which province or territory are you joining us from today? And that includes outside of Canada. You may not be in Canada today and joining us from elsewhere. So we'd like to get an idea of that. It may not be where you work day to day, but where you are right now. And you'll see we have a very large range of colors that could be in this pie chart, and not all of them are represented. That isn't too surprising. We are striving in this consortium to include all provinces and territories, include people from all areas of Canada. And we know that we probably have some work to do that. But it's nice to see a diversity of geographies joining us today. So thank you. Okay, so we'll get into a little bit of the meat and potatoes, as they say. So what is the consortium and how is it operating? So we'll start with our purpose statement. And this was what was written into the documents that were funded by the Canadian Institutes of Health Research. And I really like this statement, and it talks about the vision for this consortium. And the vision is that every Canadian child with cancer will have access to the latest scientific advances, diagnostic tools, therapies, and supportive care, leading to better outcomes and quality of life. So that is what we want to accomplish as a group. I will give you a little bit more about the background and how we got to where we are now, and then we'll talk a little bit more about where we're going. So I think the first point is something we should all remember, and that's the power of advocacy. The CPC was created as a result of really dedicated parent and patient advocacy for change. So wanting to see a change in the way children with cancer are diagnosed and treated in this country. That resulted in a line item in the federal budget for money to go towards a pediatric cancer network. And the pediatric cancer community came together and submitted a single application to our granting agency, CIHR, and that resulted in funding of $23 million. The term for that grant is June 2022 to 2024. So theoretically, we're about halfway through that grant. However, we have been assured that the funding will continue longer. So we have 4 years, so really till 2026 to spend the money that we've been granted. So that is the first phase of the CPCC. And a lot of our work will be about continuing this and making sure we have subsequent phases and sustainability for this organization. So the CPCC is led by 3 co-chairs. So these are the 3 very important people named on that grant as the co-leads of it. Drs. David Malkin and Jim Whitlock are both at SickKids. And very importantly, we have the voice and expertise of Adrienne Kodire, who is a person with lived experience and a parent and an advocate for change. At the moment, and it's really up to the moment, we currently have 4 staff members supporting the CPCC, including myself. and another 3, and you're going to meet them shortly. And we are hoping to recruit another 3 people to support the work that we're doing and all of you are doing. But in general, the CPCC is a big collective. It's a multi-stakeholder collective. It includes clinicians, researchers, survivors, advocates, and other stakeholders from across Canada. It's meant to be diverse. We're trying to get really broad expertise. There are lots of people we have not included yet, so we are looking to expand that stakeholder network. But that is the type of organization we're trying to build. And the work that we're trying to do, there are really 2 major things. The first, and the one that's most current and most active at the moment, is to support research into all phases of the pediatric cancer journey, so the patient journey. But the second is really to establish this network to build the kind of organization and consortium that we want to see to have transformative change. So to drill down into that a little bit deeper, our work together is really built around these 5 areas. We're about engagement. So we're trying to engage this multi-stakeholder network and really make sure that the organization that we build represents the breadth and richness of Canada's cultural and socioeconomic and geographic diversity. We're looking to leverage and connect both research and clinical expertise across the breadth of cancer types, and really from birth through to survivorship. We're about building partnerships and integrating that patient voice and that personal lived experience voice into everything that we do. As I said, what we really want to see is transformative change, to see faster, fairer, more effective, and safer cancer care for children in Canada, and to create a unified national strategy. So there are a few pieces of really ground-laying work that have been done already to really sort of set up this organization for success. And I want to thank the many people that contributed to these pieces, but one of the important ones is an equity statement. So one of the first pieces when I joined in April that was completed, thanks to people's work before that, was to develop this equity statement. And that really emphasizes that this is a partnership and that we are committed to upholding the values of reciprocity, equity, and human rights in everything that we do. And that part of our role is really this issue of access and equity, that we are committed to addressing systemic inequities and ensuring that historical groups that have been left out of the system or oppressed are part of this. And Stacey's comments about Indigenous patients, of course, are really related to this. The other part of work the other thing that's part of the equity statement is a series of values that have been stated, and you see these listed here. They are about the fact that we are patient or survivor and family centered, that this organization is collaborative, that we are anti-oppressive, that we are committed to innovation and excellence, and that innovation and excellence partly comes from bringing all these different voices to the table, and that we are accountable, that we're transparent about how decisions are made and how we're allocating our resources. The other piece of work that we've done fairly recently is produced a statement about adolescent and young adult cancers. So how are we including, sometimes called the AYA population, in our work? This is a unique population. It's often falls through the cracks or can be left behind. So we wanted to acknowledge that and acknowledge how we would include them in the CPCC. So because this consortium's focus is really on childhood cancer, not every young adult with cancer is included within the scope. So what the breadth that we've included here is, of course, patients that are less than 18 years of age, any patient, any person who is a survivor of pediatric cancer and is now over 18 years of age, and then also young adult patients in that age bracket there that have been diagnosed with a cancer that typically occurs in children or adolescents. So what we're trying to build I guess, if I can summarize some of the previous slides, is really a new kind of organization. We want an organization that is interdisciplinary. We want it to be inclusive, and it's really important that the voice of people with lived experience is woven throughout it at every level of the organization, including decision-making bodies. And one of the tricky things, I think, is that part of our work, in addition to pushing forward with innovative research and excellence, is to figure out what we want to be while we're currently building it and living it. So that's why it sometimes it seems difficult to bring all those pieces together, and that there's a little bit of a feeling of chaos to this, but that's okay. We know that's there. It's okay to feel that. And a lot of what we'll be focusing on is not just the here and now and what are we trying to achieve in this period of the CPCC, but how are we building this for the future and for longevity. So the types of questions that we are starting to ask ourselves to go into this is, what type of national organization would be most impactful for the pediatric cancer community? And what can we do that will be transformative? And you're going to hear more about those types of questions at the December meeting that we'll discuss at the end. Okay, so a little bit of the how this works, how we're organized. So we are organized into these 7 key areas of research that we call themes, and you can see them listed there. And then there are 2 cross-cutting themes or groups, one of which is knowledge mobilization, and the other of which Stacy represents, which is social justice, indigenization, and inclusion. So those are kind of the 9 key groups that we currently have. Each of those groups is driven by a group of co-leads, so people that have volunteered to co-lead each of these areas. Again, those are multidisciplinary co-leads, and I really can't thank those people enough. It has been a huge amount of work for them to engage with their broader communities and bring projects and proposals forward to us that they are prioritizing and want to see funded on behalf of their communities. So thank you. If we go to the next slide, I'll talk about who we are so far, our small and mighty team. So this is all being helped now by what we're calling a secretariat. So people whose work it is to make this a success, but also to help all those people who are volunteering their time to make the CPC the organization that we want. So as I say, I'm the executive director. Our director of operations and strategy is Stephanie Grover. Many of you will know Stephanie well. She's been involved in Profile and is someone well known to this community and has been incredibly dedicated to the pediatric cancer community. So I'm thrilled that she's our director. I'm also thrilled by my other 2 colleagues. Helen Petropoulos joined us about a month ago as our program manager for engagement and partnerships. And so she will be helping us really build out our stakeholder community and connect us to organizations and people in Canada and internationally that we need to help make this a success. And then Jenna has just joined us. She's brand new, Jenna Craig, as one of our project managers, and her influence is already being felt, I know, in some of the theme meetings where she is helping with all the pieces that are required to organize groups and move projects forward. So a thank you and a welcome to Helen and Jenna, and a second thank you to Stephanie for staying with the team. The rest are all in progress. We're hoping to hire an additional project manager, communications officer, and admin person really in the next couple of weeks. Okay, the other thing I wanted to talk about was leadership structure. We've had an interim, sort of what we've called a transition team, helping guide the work to date, but we do want to move to a more structured leadership. And so I'll just take a moment to go through this slide. I've mentioned already our 3 co-chairs, Jim, David, and Adrienne, and they will form, they are still going to exist as a slightly different group as our executive, because they have really specific responsibilities related to the CIHR funding. So decisions related, particularly financial decisions related to the CIHR funding, are the responsibility of David and Jim as the Sick Kids co-PIs. So they have a slightly different role, but most of the decision-making and advising is going to happen at this level of the Senior Leadership Committee. So this is a new committee. We haven't started it yet. We haven't missed anything. And that Senior Leadership Committee will be made up of the 3 co-chairs that I just mentioned, but also 7 other members. And we are seeking self-nominations here for this committee. That's a big arrow. This will be an opportunity that we'll make available to the community early next week. But what we're trying to do here is balance geography and gender and career stage and expertise, and make sure that we have at least 2 people with lived experience on that committee. So that's going to be a really crucial committee, to the somewhat similar to a board, if you're familiar with other with not-for-profit structures, that will help us really move forward. And as I say, you'll have an opportunity to nominate yourself for that. And we will share that nomination form as well as the charter or the terms of reference for that committee next week, so that you can get a little bit more detail about it. The CPCC will be advised by an external advisory board for the science, and that will be sort of 4 to 6 members, the science and also the organizational structure. And then we'll have some internal advisory groups, and those will be focused on, for example, SJII, a partnership forum that doesn't exist yet, but we see having a partnership table for our partners to engage with us, a network of people with lived experience that we'll talk a little bit more about in a moment, and a sustainability committee to make sure that we have our long-term vision of what this organization will become. Then the other 2 committees there, the co-leads already exist. So that's an existing group of people. It's not really structured as a committee, but it is an existing group of about 54 people that are really pushing forward the work of the themes and groups. We are proposing also to have a subset of that group, which will form a leadership committee. So a slightly smaller group that's a little bit more nimble, that can be consulted to on issues around the research activities of the consortium. Okay, so with that, we'll move into updates on the consortium theme and group activities. And since you're probably tired of hearing from me, I'm going to turn it over to Stephanie to discuss a few things.
Thanks, Christine. Hi, everyone. So I'm Stephanie Grover, and the Director of Strategy and Operations, as Christine mentioned. So I'm just going to talk about some of the work that has already been in progress and submitted. So from all of the different themes and cross-cutting groups, there have been a number of submissions for priority work and projects that have already been submitted. And these cover a great breadth of different type of research areas and interests that work towards building the consortium and building the capacity and answering the different research questions that we all hope will be addressed to accomplish our ultimate vision and goals. So they extend from bringing together existing resources through to facilitating participation, Canadian participation in innovative therapy registries that exist in other jurisdictions or other countries to make sure that we have access to those resources within Canada, to investigating regulatory and policy challenges within different innovative diagnostics and therapies, to ensuring that we're looking into the equity and access to both of our healthcare and research data and trying to create common structures, tools, and platforms for sharing and accessing this information, through to the implementation of digital tools and resources to help with survivorship care planning, so that that information can be better utilized and accessed by both survivors and their healthcare providers, and ultimately actively engaging also with youth living with cancer in different participatory action framework. So these are just some of the topics of the priority work that have already been submitted. but we are continuing to work with all the themes to continue to further their work. And what I'm about to go through is to discuss each of the different themes in each of the different groups and some of their progress to date. So the first committee that we've heard a little bit about already is the Social Justice, Indigenization, and Inclusion Committee. And their overall objective has been to create and curate guidelines for inclusion of equity deserving groups across the entire consortium. They've been helping and continue to help with reviewing all project proposals in order to be able to ensure adherence to different guidelines that we're making sure are consistently followed throughout all of the work that we do. As Stacy mentioned, working to build expert councils for equity deserving population, including Indigenous collaborators, to ensure that we consider data governance and their involvement in all of the projects and project direction, and the development of projects that answer questions that are being asked by our community in an appropriate and respectful and meaningful way. So one of the major things that this group has helped us do is to ensure that all of our work across the consortium will adhere to principles that have been discussed and have been outlined in a number of ways. But these include how to bring EDI, equity, diversity, and inclusion principles to all of the work we do, to ensure adherence to data governance guidelines for all equity deserving populations, but such as the First Nations principles of OCAP, ownership, control, access, and possession of data, and that the idea that data will not be collected from patients that have declined participation in research, so respectful and appropriate use of people's data and consent for the way they would like to be included in different research and in different work. And one of the things that has been very well expressed is that this group, the Social Justice, Indigenization, and Inclusion Committee, are very happy to work with all teams and groups and any stakeholders across the consortium to ensure that they have the support and also some guidance if needed for adherence to all of these principles across everything we do. So one of the upcoming presentations that they're giving is on November 1st at 3 p.m. There will be a social justice, indigenization, and inclusion education session that has been being created by two of our fantastic leaders in the Social Justice, Indigenization, and Inclusion Committee, Stacy and Carolyn. And it will be about research including marginalized populations affected by childhood cancer. And this has been also organized by the education and training theme. And more information will follow and be sent out publicly about this as it develops. For our what we refer to as theme 1, which is cancer biology, this group has been trying to push the boundaries of key biological questions within the pediatric cancer space. So they've been looking at everything from relevant molecular testing for each different tumor type throughout the cancer journey, and beginning to look at how to make sure that all of the data that is collected and established is accessible to support the request and pushing forward equitable access to molecular testing and hopefully moving it to standard of care for all Canadians across the country, and trying to remove the barriers and silos that have been impeding research progress within the pediatric cancer space in Canada. So bringing all of the different groups that are working on research together in order to continue to move things forward. So some of the priorities that they have been working on is to consolidate and expand some of the infrastructure that already exists and the expertise to develop research pathways to move things forward, to look at all of the biobanking and data, both clinical and molecular collections across the country, and find ways to integrate this data with one another so that there is better sharing and better access, to increase capacity and access to different omics, which are genomics, transcriptomics, looking at different of those analyses, and drug screening and modeling. And they also are looking to create a national network of excellence to begin to address key questions in a collaborative and national way, so that it can be actually accessible to all those who would like to move these projects forward across the country. They have recently recruited a project manager to help work on some of this work. They are developing 3 national research projects that focus on brain cancers, sarcomas, and infant leukemias. And they are advancing the access to molecular testing, focusing on proteomic profiling and circulating tumor DNA. And they are also working to establish platforms to accelerate, as I mentioned previously, modeling and drug screening. Christine, I'm going to pass it back over to you.
Yeah, so I'll talk about clinical trials, and you'll notice these themes sort of trace the cancer journey for children. So we'll move into clinical trials. And the objectives for this theme are really around, as you can imagine, developing and supporting important Canadian investigator-initiated trials, or IITs. So these are brought forward by Canadian scientists and clinician scientists. There's also an objective to develop the capacity to enable more centralized trial management, so to make these trials easier to run and to streamline trial activation so they can happen faster. And then third important objective is to build ways that Canadians across the country can access clinical trials, so build remote access to trials or studies. So their priorities, they were looking for or asking for proposals for trials across disease areas, and that call for trial concepts is now completed. Upcoming are submissions of trials that are in need of CPCC support, and also a clinical trial incubator initiative. So the idea of supporting earlier concepts that aren't quite ready for trials yet, and also looking at a cellular therapy network proposal. So recent activities in this group, I can tell you, has been really active in the last couple of weeks. 5 studies have been identified across different areas of different type of cancer types, different domains, and some are being prioritized to be submitted forward for funding. There is also a proposal for a clinical trial incubator, so essentially a seed grant to develop Canadian concepts. And more recently, they've been working on a potential collaboration with another network called MyCERN, the Maternal Infant, Child, and Youth Research Network, particularly around that idea of centralizing trial management, so sharing some data management systems.
So on to the access and innovative therapies theme. Their objectives are multifold: to improve patient navigation within the country, to improve access to novel and innovative therapies, and to get children to trials and trials to children. So their priorities are to do an environmental scan of patient navigators and access to patient navigation in general across the country, to open the Pediatric Proton and Photon Consortium Registry at multiple Canadian sites in order to make sure that there is Canadian participation in this American registry, to develop a centralized framework for navigation and funding processes to assist patients and families access to clinical trials, and to reduce disparities in access to innovative therapies. So they have project proposals that are being developed for pan-Canadian survey regarding patient navigation. They have received funding that will be able to be used to facilitate the opening of the Proton and Photon Consortium Registry at a number of Canadian sites. And they are exploring options of somewhat of a concierge service in order to be able to centralize resources for travel and information to innovative therapies and clinical trials. And they are meeting with other themes in order to investigate reducing policy barriers and other barriers to access of innovative therapy and other access issues.
Okay, so speaking of policy barriers, the theme 4 is really focused on regulation, policy, and economics. And this group's vision is to ensure equitable, efficient, and sustainable cancer care for all Canadian children and youth. Really almost a vision for the whole CPCC, so certainly aligned. And the objective of this group is to develop a rigorous program of health policy and systems research that will enable evidence-informed policies and programs to meet that vision. So their priorities have been regulation and policy research on innovative diagnostic and therapeutic technologies for childhood cancer. And they're particularly focused on this idea of, or the concern about disparities in access to childhood cancer care in Canada. So in terms of recent activities or proposed projects, one that has come forward is they're working on an innovative diagnostics project and doing a description or analysis of the current state of regulatory and policy approaches to innovative diagnostics for childhood cancer care. And then as part of that, they're conceiving what an ideal future state would be. So a better way to do this, and looking at ways to surmount some of the challenges they are seeing in the regulatory, the health technology assessment, and the reimbursement space for childhood cancer related technologies. And in terms of methods, the kind of research that this is they're doing comparative policy analysis, so looking interprovincially, but also looking internationally. And then they're also doing case studies where they're doing sort of a gap analysis by focusing on some specific exemplar technologies. So especially around whole genome sequencing, whole exome sequencing, transcriptomes, and cancer panels. So the types of technologies that go into cancer diagnostics. And they're looking at what the regulatory environments are, health technology assessment environments are, and what the funding process is for those technologies in Canada, but also looking at international examples.
So for the education and training theme, this theme is actually functions across the entire consortium as well. But they've divided their objectives into two aims: one, to improve patient involvement in pediatric cancer care and research, and two, to enhance career development and training opportunities for the next generation of pediatric cancer clinicians and researchers. And so the priorities that they have set thus far are to conduct an environmental scan and needs assessment of existing educational resources across all of the pediatric cancer space, the development of an online centralized learning hub, research and career development curriculums, and these will help hopefully support the education and accessible information from all of the different educational resources that already exist, and for any gaps identified, be able to fill in those gaps as well. They are wanting to support the education and training of persons with lived experience across the entire consortium, and to work with other themes to ensure cohesion in plans and activities when it comes to education of any of the different topics or research that is going on within the consortium. Their recent activities, they have begun to draft a process and policy for how to have subsidies for people with lived experience to attend educational events and conferences and have support for that. They are beginning to develop research curriculums for healthcare providers and researchers, and shortly a survey will be sent out regarding the needs and interests for these curriculums. And so if you're one of the people who might fall into this category, please look out for that email and consider filling out that survey. And they are also working on the creation of a patient and family education council to make sure that all of the information that were created and stewarding lasts well beyond the initial 2-year term of the grant and continues to evolve and be utilized for all those who are involved in the consortium.
Okay, the sixth of our 7 themes is ethics, legal, and societal issues, sometimes called ELSI for short, and also implementation science. And you can see there their overall objective is to contribute to our study of these ethical, legal, and societal implications of research. Their priorities are around facilitating data governance and sharing across CPCC members. I can't overemphasize the importance of this. So we are only as good as our ability to share data and to govern it appropriately. So this is really important work and will really contribute to our success as a national network. They are interested in fostering the communication of patient data and access to results, to research results by families, by minors and other healthcare providers and researchers. So how do we communicate those results better? And the last one, which I'm sure will resonate with many of you on this webinar, is streamlining cross-Canada multi-center pediatric oncology research ethics boards reviews. So recent activities, they've had many team meetings and also have been working on collaborations with other themes, because as you can imagine, these things are relevant to a lot of the work of the other themes. There have been 2 projects submitted on governance and communication of data. And as is written here, those projects have been awarded and approved, but they haven't opened yet, ironically, because they're stuck in legal issues between the institutions. But we are working to resolve them so that the money will flow shortly.
The next theme is psychosocial and survivorship, and their overall objective has been to advance the well-being and quality of life for pediatric oncology patients, childhood cancer survivors, and their families, including preventing and managing lingering side effects of pediatric and adolescent cancer treatments. So their priorities have been to identify and pilot implementation of a comprehensive means to assess patient-reported psychological and health outcomes in children and in psychosocial screening for their family. They are working to develop and adapt a national passport for care to assure the best care for children and AYA cancer survivors is available within Canada. And they are creating a catalog of e-health and mHealth applications and platforms to be made available directly to children and their families to help with symptom management, reporting, and learning about treatment. And this is really about making sure that all of the latest advancements in electronic communications and mobile technologies are actually being able to leverage and be put to good work for the patient cohort in Canada. Their recent activities and proposed work is that they have been working on, and it's underway, a scoping review to describe the psychosocial health measures for children with cancer and their families. And they are going to be piloting, and they're doing a full text screening, and that's underway. They are hiring a project coordinator to help with all of the initiatives that they are undertaking to make sure that they continue to move forward. They're having discussions related to data privacy and other regulatory aspects with respect to implementing that passport for care and survivorship so that information can be accessed and shared both for survivors and their healthcare professionals. And they are going to continue to have town halls with their stakeholder group, as all of the different themes are going to continue to reach out to their stakeholder groups to update the community members who expressed interest in their work, and those will be happening in the next short while.
Okay, so knowledge mobilization, if you think back to that figure we showed, is a cross-cutting theme, and that's because, of course, like data sharing, the success of us as a national network really depends on us sharing information and knowledge across the organization, across the country. So their overall objectives are, first of all, to establish a knowledge mobilization plan based on the needs of the pediatric cancer community, both in terms of the content and how it's shared, so the media. They will be setting up they would like to set up a knowledge mobilization hub for the CPCC. And the third thing, which personally I find quite exciting is to advance the science and practice of youth engagement in pediatric cancer research. So their priorities are really defining the hopes and aspirations of youth with cancer and their cancer experience, engaging youth through a type of research called participatory action research, and then defining the most important knowledge mobilization needs of the pediatric cancer community. So asking questions like what part of knowledge should we mobilize and share first? And how do we do that? What media is the most appropriate? So projects that were recently submitted are listed there. One is around advancing inclusive youth-led research in pediatric cancer. That's the participatory action research proposal. And the second is slightly cut off for me, so I'm going to try to read it, but describing, prioritizing, and supporting the knowledge mobilization needs of the Canadian pediatric community.
So before I move on to the next slide, I just want to say that this has been a very brief, although maybe not so brief, snapshot of the work and priorities of the different themes and groups throughout the consortium, but there is much more work being envisioned to move forward in all of the different areas. We are also developing what we're referring to as a People with Lived Experience network, which is a new network that we're developing consortium-wide for people with lived experience. What the network's functions will be determined by all of the members and all of the people who would like to be involved in the network itself. The network had a preliminary meeting with some stakeholders on July 31st, and we are planning to have the next meeting on October 20th. I am one of the CPCC secretariat members that has been designated and is very lucky to be able to help support this person with lived experience or people with lived experience network. So I am very happy to be involved. And if you happen to be a person with lived experience of childhood cancer and you would like to become more involved with either the consortium as a whole, any of the work that we described or beyond, or you want to learn more about the specific PWLE network or would like to attend the next meeting, please do not hesitate to contact the CPCC office email, which is there, or myself, and we would be happy to make sure we connect you with any member of the consortium so that you can be involved. So with that being said, we will hand this over now to Helen, who will take us through the next slides.
Great, thanks Stephanie and Christine, and hi everybody, I'm Helen. I'm really excited to join you all and be part of this really important work. And our next, I guess what we want to do is remind you about our consortium annual meeting coming up in December. Registration is now open, and if you actually scan that QR code there in the bottom left corner, it'll take you to the registration page. We hope that many of you can join us. It's going to be a hybrid meeting, but we hope to have as many people in person here in Toronto as possible. We can go to the next slide, Stephanie. So lots of goals for the meeting. Certainly, we want to have a lot of great networking across the consortium, both across all the themes, and also an opportunity for smaller groups within themes, within groups, and within projects to meet together. And we also really want to facilitate discussions regarding the future of sustainability and a strategic plan for the consortium. So I think that'll be really of interest to a lot of the folks on this call and broadly. So we hope you can join us for those important discussions. And again, this is a hybrid meeting, but we encourage as many to join in person as possible. And there are some travel cost reimbursements available to help facilitate that. And I guess we're excited. I am, as somebody that's new, I'm excited to meet a lot of you in 3D in December. So, and another piece that's coming soon as well is our name, branding, and communications. This is something that we're actively working on, building the communications plan and tools for the consortium, including a website and so forth. So all of that is happening in the background. We're working as hard as we can on this. We know it's of great interest. And in terms of the new name and brand, we want to thank everybody that took part in the survey, the recent survey, and we'll get back to you on where we're going with our new brand soon. So I think with that, I will send it back over to Christine unless I miss anything.
You missed nothing.
Awesome.
So thank you, Helen. Okay, so we booked this webinar for 90 minutes. So we will continue as long as we can. And as long as you have questions for us to answer. So what we'll do now is we'll link into the Slido and we'll go through questions that have popped up in there and try to our best to answer them. And you can, so I noticed there were a few questions in the chat. So if you put a question in the chat, if you could type it into Slido, then that will enable us to answer it with everyone. So we'll just go through what's here. So someone wrote they've attended a first meeting in 2022 and 2023 for 2 of the matrices or themes that this person signed up for, but haven't heard anything since then. Are they happening? So they're definitely happening. I think you probably got a sense of that from the updates that we just gave, that those themes are working hard to get their projects put forward, and in some cases they've already submitted projects for funding. However, if you would still like to be engaged and feel that you haven't been, we would encourage you to reach out again to the co-leads of the themes that you're interested in, and just to email them and ask to be included in future communications. And one thing, it's awkward us not having a website, which is why we're prioritizing getting that as soon as possible. But one thing we can do is circulate the list of the co-leads so that you know who to reach out to. So we can do that after the meeting. Re-theme 5. So I might hand this over to Stephanie in a second because she walked through theme 5. But the question is really, which is the education and training theme. So what sort of education and training do they wish to provide for persons with lived experience? Stephanie, do you want to talk to that?
So I think this is a question that can be addressed by the theme itself in future correspondence as well, but they are looking to bring together information that is necessary in general, and they're going to be looking to the people with lived experience, I believe, for understanding any sort of gaps or any sort of helpful resources. This is also something that I believe through the People with Lived Experience Network, we will also be talking about what would be helpful and what would be useful. But I think some of it is as simple as access to education at different conferences or meetings, or different resources about communicating and advocacy and whatnot, all the way through to learning about the research, like how to do research or how to be involved with research across Canada and more. But if you would like more information, I think it would be very good for us to connect anyone with the education and training co-leads, and we will be happy to do that.
Okay, so a question on so I think I know most of these acronyms, but not all of them. So I'm going to give it a shot. So who are the leads for the psychosocial oncology and survivorship theme? Okay, I think this is right. Nova Scotia Health. I'm not sure about CCP, and the IWK, which is of course the hospital in Halifax, are doing work on both psychosocial oncology and survivorship care in Nova Scotia, and I would like to connect with the leads. Okay, so that's great. So there are actually 7 different people that are the leads for that theme. So if you want to just send us a quick email afterwards, we will make sure that you are connected with that group so you can hear more about what that theme is doing. I couldn't find the travel policy details online or via my emails. Sorry about that. Would you mind sharing by email at some point? So Stephanie, what's the best way to find the travel policy? I think it's linked. I assume you're talking about the December meeting, and I think it is linked to the registration site. Is that right?
The travel reimbursement details are linked with the registration site, but if you specifically want the travel policy, we can definitely send that to you. And any sort of travel reimbursement information will be shared with everyone who registers before and after the meeting, so that everyone is aware. but definitely send us an email and we'll be happy to make sure if you can't find it in your emails yet, that we can send it to you once.
Yeah, so just hi Meg. I can tell it's coming from Meg. It's no longer anonymous. Megan, just feel free to email us and we'll help you find all the details. This is the problem with two mediums, Slido and chat. Okay, how do we access the webinar recording if we miss some of it? Really good question. Stephanie will circulate it.
Yes.
Okay, so we will, since our current medium is email, we will circulate it by email to everyone in our stakeholder community. So you will get the recording that way. And in a few weeks, maybe a month, when we have a website, we'll make sure that we post it there too. Stephanie, do you want to take this one?
So there, for any people with lived experience across the consortium, there is the ability to seek reimbursement for a time that is devoted or contributed to the work of the consortium, and we can share that. For future meetings, the education and training group is developing like a subsidy process and policy in order to be able to apply for meetings that people would like to attend for educational purposes, or for just wanting to learn more about or attend a meeting. And that will be rolled out as soon as it's available to all of the stakeholders within the people with lived experience groups within the consortium. It is not ready as of yet, but it is a piece of work that's being worked on, and we hope will be available much before the end of the year if possible. So more to come, but yes, there is support that can be provided for people with lived experience and their involvement both at meetings and potentially at future.
Okay, so the next comment I think is I agree with, very on point. So as a Pan-Canadian consortium, it would be useful to have a discussion on the locations of the leads, co-leads for project teams, committees, and working groups. So yeah, so I think we, I had a quick look at that pie chart that we had at the very beginning, asking where people were dialing in from or calling in from. And, there's clearly the biggest part of the pie was Ontario. So we do want to make sure that we have representation from across the country, involvement from across the country. So we are actively trying to build committees and project teams that are Pan-Canadian. You'll see when people submit projects, that's a comment that often goes back in the review process, is around, being more inclusive, being more national. So this is a priority, and that is why in the leadership structure, in that senior leadership committee, we talked about really balancing not just geography, but other factors like gender and career stage and expertise on that committee. So I agree, and it's certainly something we're working on improving. And then the next question is an interesting one, which is, will the breakdown of the overall plan for the budget expenditures be made available? So, I mean, I think that's a good question. And given that one of our values is accountability, I think that would be a good thing to share on certainly big picture in terms of sort of big buckets about how it's been budgeted to support all the work of these different themes. And I'm just looking at Stephanie to make sure she doesn't violently disagree with me. No? Okay. Okay. So that's something we can work on providing for sure. What is the email? Oh, so actually it's going to come up in the very last slide. We'll show you the email again, but the general kind of reach out to the CPCC team email is cpcc.office@sickkids.ca. And we will, as I say, that will pop up on the last screen, so you can write it down there too. But if you need to reach us with any question, that's a good general email box. How can people who are 100% clinical be supported to be involved? This perspective is very important. I agree, but I might need, I don't know if Jim wants to weigh in on this or not, but I might need a little bit more information to understand what you mean by that. But Jim, I don't know if you have any thoughts on how to involve more people who are purely dedicated to clinical work in the work of the CPCC.
It's a great question. There are a lot of people, I think, who have significant clinical commitments, who are involved in various aspects among the thematic matrices. I'm not sure what be supported means. If it means financial support to buy out people's time, I don't think there's any mechanism for that, or likely to be. So I agree with you, Christine. I think it would be important for me to also understand exactly what the question is here. I know that people who are 100% clinical may not have time for regularly scheduled meetings during the week. I think we've all struggled with that in terms of trying to build capacity. But I think they're going to be, people who are 100% clinical still can be involved in trainee education, patient and family education. Survivorship is a part of clinical care. So there are realms within the CPCC that could be argued have very much a strong clinical aspect. Maybe not so much the biology node, for instance. So I think it just depends on what people want to do.
Jim and Adrian, you might want to stay on for the next. So thank you for that question and the answer, Jim. So the next question is, so I think, how was the decision made who the leads will be? I'm assuming this means the co-leads of the CIHR application, and that actually predates me. So I don't know if Jim, if you want to give a little bit of history there about how that evolved.
Sure. So I think those of you who were involved from the time that this announcement came out are all aware of the extraordinarily tight, compressed timeline to get a grant application pulled together and submitted. So I would be the first to acknowledge that there was not a lot of time for significant transparency or solicitation of participation. I think many of the people who were asked to serve as co-leads and who had a role in helping pull together the grant application were people who already had roles in Profile or C17 or one of the various thematic leads that thematic matrices that have been talked about earlier today. And that was really, I think, a necessity to get a competitive grant application pulled together. There was also an effort subsequently to involve people with lived experience in every thematic matrix that we had. And obviously, because this organization is different from the pre-existing organizations, those decisions were made subsequently with input from the existing advocacy communities. I think we're all aware that social media would have been a very effective tool in soliciting participation, but we were barred from being able to do that by CHR until such time as they made the announcement about the official launch of the consortium, which happened months after we were notified of the award. I'll see if Adrian has anything to add.
No, I'm quite happy with what you said, Jim.
Okay. Any last questions? We've run out of questions in our roster. And thank you, Jim, for addressing that. Oh, one more. Are there any co-lead vacancies and how can we throw our hats in the ring? I'm interested in a bigger role in CPCC. Okay, great question. So the co-lead groups are actually sort of fluid, and there is no set number for the different who's contributing their time and energy to leading those themes. So I think if you're interested in being more involved in a particular theme or group, then it's just a question of reaching out to. You can reach out to the CPCC office, and we'll direct you to the right people to connect with that. And then the bigger role in CPCC kind of depends on how big you want to go. But as I mentioned in the presentation, We are going to be putting together that senior leadership committee, and we will be sharing both the charter so you can get a much more detailed idea of what that group will be doing and their responsibilities and the time commitment, as well as a fairly simple form to, as you said, throw your hat in the ring. So to apply to be on that committee. So that will be coming up early next week. A summary of the locations of the leaders would be helpful to assess where we need to go. Okay, yes, for sure. So we can put that, we can certainly put that data together. I think the caveat there is that we're still establishing all of what those different leadership committees, who will be on those different leadership committees. So as I just said, we're still recruiting people to be on them. So once we do have that, then we're happy to share our geographical representation with the idea of broadening it as we mature as an organization. So I'll give it a minute or two for any last questions. And obviously this is not your only opportunity to ask questions. You can reach out to any of us. And actually, maybe we can go to the next slide if you don't mind. So there, as promised, is the CPCC office email. So our general mailbox, and you can reach out to us anytime, and we will be happy to respond and direct your question or respond with whatever you're needing. And we look forward to having more robust communications and ways of communicating and ways of sharing information. So as I say, or as Helen said, our communication strategy is coming. So in the meantime, I just want to say thank you, merci, miigwech, to all of you for your time and your participation, and for many of you for the number of hours and energy and thought you've already put into the CPCC. And we look forward to engaging more with you in the future. Thanks.